Very good evening, friends. Meeting again in the session of Robert's philosophy, and we're discussing regarding the most important chapter, that is the role of homeopathy and homeopathic therapeutics in the field of endocrinology. Robert has given a very thorough explanation by introducing the correlation between the endocrinology and homeopathy. At the same time, he has tried to explain that how homeopathy will be useful and will going to cure all those problems related with endocrinology, whether they are hyposecretions of endocrinal glands or hypersecretions of endocrinal glands, named with certain syndromes. And thereafter, he explained one important thing, that the way we used to treat any chronic disorder, in the similar manner, we can treat this specific disorder. So there is no question of a different approach in dealing with the endocrinal disorders. It is one and same. The way which you approach any chronic disease, in the similar manner, you have to approach with this endocrinal disorders. The first important thing is that totality of the symptoms is very important thing for you. And with the help of totality of symptoms, considering the constitutional symptoms, constitution, miasmatic background, everything which you have to take into consideration over there. And once you get a clear remedy, then you have to go to the Matra Medica to find it out exact remedy, and then you have to reach to the Organon to find it out exact potency and repetition. The approach remains to be one and same, and that's why we must know what are the different types of syndromes and what are their manifestations and how individually we can look towards them. Then he has tried to explain certain remedies for endocrinal disorders, the common polycrest which comes again and again. But at the same time, he is explaining these are not only the remedies which are useful for endocrinal disorders, it depends upon the case. It varies from case to case. He has started with pulsatilla and explained that pulsatilla doesn't play so much of role because it is subacute in action. Then he explained about the lycopodium, one of the important polycrest and very useful in endocrinal disorders as a constitutional remedy. The sulfur second, which he has explained over there. After that, he has explained the phosphorus and phosphoric acid. Both of them plays very vital role. Both of them acts on glands. Both of them are from tubercular myasm, plays very important role over there. Then he explained one psychosyphilitic remedy, that is nitric acid. And the correlation of nitric acid in relation with endocrinal problems, that is what he has explained. Then again, he has explained the lycopodium in detail, explaining that lycopodium is also called as the vegetable sulfur. And then he explained the lycopodium and its correlation with the endocrinal glands. And then he started explaining about the natrum group. We have learned few remedies from natrum group, which are very useful. As natrum is remedy or natrum group is closely associated with human emotions, the endocrines also has very close relations with human emotion. And that's why natrum plays a very vital role, and all remedies from natrum group takes part in the endocrinal disorders. He has started with natrum ars, then he has explained about the natrum car, then he explained about natrum hypochlorosum. Then in last lecture, we have discussed in detail about the natrum muriaticum and its relation with the endocrinal problems like hyperthyroidism. Then we have discussed ignatia as a acute of natrum mur, but emotional shock giving rise to the diabetes is the ignatia over there. So this is what we have discussed in yesterday's lecture. Let us finish the natrum group completely. The next in consecution comes the natrum phosphoricum. So we were there on the page number 254, the last paragraph. Natrum phos. Natrum phosphoricum children develops improperly because of excess of lactic acid in their diet. Very important. These are the very essential hints one must know why they are suffering. There is one rubric, acidity children in, and natrum phos comes over there. Natrum phos is one of the important remedy for acidity in children. It merits wider use than it has received, and its general features are marked by the parent substances like phosphorus. It is effective in diabetes, but here it shows its relationship to the natrums because this diabetes is apt to be a reflex of hepatic derangement. So natrum phos, it is the hepatic derangement because of which diabetes which develops over there, and both elements are defecting. The natrum itself is a very defecting, phosphorus itself is a very defecting. So natrum phos itself is a defecting remedy. There is much disturbance of the sexual organs. There is weak back and trembling limbs, especially knees after coition and after nightly involuntary emissions. So this is again one important feature of the natrum phosphoricum, that there is a involuntary emissions during sleep. Second important thing, the backache and weakness in legs after coition, another feature of the natrum phosphoration. And then he explains, instead of weak and lax muscles of the natrum carb, we find here a tension of muscles. There is inability to apply himself to his books, and even the efforts causes despondency. So concentration is quite difficult. They are unable to concentrate and they suffers a lot. So these are the very typical features. Generally the diabetes, generally the glandular affections which happens to be there comes in the sphere of natrum phosphoricum. So natrum phos being a defecting remedy always helps in endocrinal problems. Then the last remedy from natrum group, which he explains over there, is natrum sulfuricum. Natrum sulfuricum is usually gloomy, even for his gloomy family. We have learned about natrum sulfuricum lot of times. If you open the natrum sulfuricum from Borix mud remedy, the first sentence itself explains the remedy. It has a very specific action, a liver remedy. First sentence in Borix mud remedy because it's a liver remedy. It is a very specific action with the liver. It also affects glandular structures. It is a purely king of antipsychotic remedy. Has a very typical aggravation at 4 to 5 a.m. in the morning. It has very typical greenish yellowish discharges. It has asthma in children, another feature, and very important remedy for traumatic injury to the head producing either headache or mental symptoms thereafter, called as cerebral concussion. Very important remedy. This natrum salt acts very specifically on the glandular system and produces many features. It is strongly hydrogenoid in tendency. So hydrogenoid constitution, natrum sulfuricum with psychotic miasm. There is marked aggravation from water and dampness. He may be so sensitive to this that he cannot eat food grown on the wet ground. He cannot live with comfort near a body of water. Natrum self has less influence on goiter, perhaps, but there is sense of constriction in the throat that foreshadows its usefulness in this field. So it has a very typical constriction sensation which happens to be there at the throat level. It has marked usefulness in the enlargement of liver and spleen and is almost useful in old malaria as in natrum. So old cases of malaria, which are not, which where the recurrence is common, natramur or natramcel plays very vital role. It is particularly valuable in glandular imbalance following injuries to the head. In fact, it is almost specific for head injuries, even long after the trauma. So, persistent effects of head injury, the mental symptoms after head injury, or headache after a head injury. Very important remedy is natrum sulfuricum. One should not forget this. Very, very useful in practice. It has profound action on the blood and it has proved its usefulness in leukemia. There is one remedy mentioned in Kent's repertory for leukemia is natrum sulfuricum. Very important remedy. This is most important psychotic remedy and it has its own role. So see, natrum group, he has started with natrum ars, then he explained natrum carb, then he has explained natrum hypochlorosum, then he has explained about natrum mu, then natrum phos, then natrum sulf. 6 remedies from the natrum group he has correlated with it and in relation with the endocrinal problems. Then he turns toward the Kali group. Kali is another important group which involves or which takes part in endocrinal problems. In his dictionary, Clark lists 21 Kalis. the majority having been well proven. T.F. Allen said that Kali salts were insidious in action and destructive of every organ and tissues in the body. So it is natural they are frequently indicated in glandular dysfunction. So these are Kali group remedies. They are very useful in glandular affections. Generally, they are from the psychotic to syphilitic miasm. That natrum sulf is always useful in the leukemia treatment. And being a psychotic remedy, if you find it out a background, past history, you can definitely treat leukemia with the help of natrum sulf. One of the important remedy, along with cyanothus, is very important remedy. Along with barretta iodide, one of the important remedies for leukemia. No doubt, the predominant action of the group is antisyphilitic. There are manifestations of primary syphilis, ulcerations of mucous surfaces, even destructions of bony structures, as in nose, as, as well as other symptoms of the miasm. On the other hand, there is marked psychotic trend as shown in catarrhal discharges, and it has field in acute gonorrhea. So remedies from Kali group generally have two miasms in background. One is psychotic and another is syphilitic. And both of them plays very vital role in the evolution of Kali group. If you start with Kali arsenicosum, you'll have a psychosyphilitic aspect. Tubercular miasm is dominant in Kali arsenicosum. If you think about the Kali carbonicum, purely psychotic remedy. Kali bichromicum, it is syphilitic remedy with acute manifestations. Then Kali sulfuricum, again a psychosyphilitic remedy. So if you go with that, then you will find that yes, definitely miasm is between the generally from venerals. The chronic Kali patients exhibits the classical stature of the psychotic, rather short than tall, chubby to obesity, and there is associated accompanying anemia. And this is the common structure, typical psychotic constitution, which you can see with the Kali patients. They are short statured, their neck is very short like this, and they are pot bellied. There is central obesity, the puffiness of the face, the edema over the lower extremities. This is common picture which you can catch with the Kali group remedies, very typical with Kalis. And that's why it has a psychotic constitution more commonly. One of the feature is anemia. Here we have perfect field for homeopathic therapeutics in endocrinal imbalance. For there is a wealth of characteristic mental symptoms varying from dull mentality with loss of memory and inability to exert mind, even to softening of brain through all states of nervous excitability with or without intelligent coordination to the high-strung nervous patients who borders on insanity or as an actually insane. Kali group remedies, out of which, if you think about the Kali phosphoricum, very specific action on the human mind. Yes, rest of the Kalis definitely have, but Kali phos is very strongly, even it has been said by the Sussler that it is a good homeopathic tranquilizer. It relaxes the mind. Kali phos relaxes the mind and gives a quiet feeling to the patient. Very important. It is Kali group always deals with the insanity, madness, and these are the remedies which are very useful over there in such types of nervous patient. These people are easily startled at slightest noise. This is very marked with the Kali carbonicum, startled by slightest noise. Fearful, apprehensive, expect to die shortly, and fear of death. Fear of death is very marked with them. Psychotic always have a fear of death. They may be as sad as natrums at times, but they are even more fearful. Natrum is not so fearful. Kalis are fearful. Both of them are sad, but Kalis are always fearful. The natrums have aggravation from mental exertion. What he says, natrums have aggravation from mental exertion, but Kalis cannot concentrate enough to bring on an aggravation. Problem with Kalis, the concentration difficult. You get many Kali salts under this rubric. Because Kali cannot concentrate, Kali cannot focus. That is their problem with the Kali group. And that's why there is a one differentiation which he has explained over there is the natrum, they are always aggravated because of mental exertion. Kali doesn't get aggravation because they cannot concentrate, so they cannot get the aggravation from exertion. And then he starts explaining one by one Kali group. We'll finish few of the remedies in today's session. Clinically, the following brief summary suggests fields of special usefulness in glandular dysfunctions and indicates further study. First remedy which he explains from Kali is the Kali aceticum and role of Kali aceticum in diabetes mellitus. So Kali aceticum in diabetes, Kali arsenicosum for exophthalmic goiter. So number one remedy from Kali group is Kali ars. Number two, Kali aceticum. Number two is Kali arsenicosum from exophthalmic goiter. They are quarrelsome, discontented, jealous. The mental symptoms recur every third day. So this is typical with Kali futures. Discontented, they are jealous, they are very, very quarrelsome, very much irritated, characteristic of the Kali group. Then two more remedies he adds over there is Kali bromatum and Kali phosphoricum. Kali brom is very closely associated with the acnes. Like, acnes are manifestations of endocrinal problems. Kali bromatum and Kali phos are most mentally degenerate of the Kalis. Both have developing softening of brain in their picture. Both remedies have done good work in backward children and aged and the aged. In the adolescents, Kali brom is often useful for acne appearing at that period. So Kali brom very important remedy for acne in adolescents. All varieties of acne comes under Kali's. That is, if you read the Alensky notes, he has mentioned all varieties. Acne indurata, papular acne, pustular acne, vesicular acne, glandular acne, cystic acne, varieties you can get over there with Calibrom. Calibrom is useful in diabetes, emissions, impotence, and masturbation, and in women, affections of the ovaries. So Calibrom has a wider range, very important psychotic remedy, very typically attached with the female complaints, specifically with the ovaries. Calibrom's peculiar mental symptom is that when walking, he is sure he cannot pass a certain point ahead of him. So there is always a doubt regarding himself that whether it will be possible for him to reach to the destiny. And there is always fear that whether they will achieve that or not. That is typical with the Calibromatum. So whenever they are walking, there is always fear in their mind whether they will reach to that destination or not. Then he explains about the Kali phosphoricum, very important tranquilizer. Kali phosphoricum has marked flushing, especially in young people. They flush and pale because of nervousness and it aggravates the nervous strain. There is marked anemia, disturbance of menstrual function, atrophy of male organs, nymphomania. See, very important feature, all related with the endocrines. The anemia, the menstrual affections, atrophy of male organs, nymphomania in females, sexual excitement, and either indulged or suppressed aggravates all the symptoms. So, Kali phosphoricum is a very important deep acting tubercular miasm remedy. It is psychotubercular, and that's why it works at many levels. So one should not forget about the Kali phosphoricum. Then comes the Kali carbonicum. Kali carbonicum is such a polycrash that it is difficult to limit it to a brief citation without omitting salient points. However, it is marked by such great weariness that she wants to lie down even in the street. It is exceedingly useful in menopause, the disorders of pregnancy, and disorders of menstrual function. It is anemic and obese with atony of the muscles. So mark close relationship with the endocrinal problems. During menstruation, the problems are aggravated. During pregnancy, the problems are there. So problems of menstruation, problems of ovaries, then problems of joints, the problems of lungs in the form of asthma, many varieties of problems which are attached with the Kali carbonicum, very defecting remedy. There is one rubric that they are duty bound, duty, too much sense of duty. They're typically psychotic. They're not industrious, but they are duty bound. They will follow their duty very clearly. So this is what related with the few of the Kalis which we have discussed today. Few are remaining. So tomorrow we'll continue with it, and tomorrow mostly we'll finish this chapter so that a big chapter from the syllabus will be covered, and it is very useful chapter where he has given a thought to read the Materia Medica in relation with the endocrinal problems. So that's all for today. Thank you and good evening.
Thank you, sir. Have a good day.